think vascular pathology is a really exciting area at the moment for dementia research. In recent years, I think we've increasingly seen that vascular pathology is important across a range of dementias, so not just vascular type of dementia, but also other conditions such as Alzheimer's disease as well. So I think there's the other fact is that because the vascular changes happen quite early and sometimes even precede the development of dementias, it's potentially quite an early target as well that we might be able to aim for treatments. The Cognition and Flow Study is a feasibility randomized trial of cognitive training in healthy older adults and people living with Alzheimer's disease or mild cognitive impairment. The reason for the trial was because of the interest around vascular changes being a potential therapeutic target for both healthy aging but also the development of dementia. We were interested to see whether cognitive training could modulate those changes in cerebral blood flow. So we used a non-invasive method of measuring brain blood flow called transcranial Doppler ultrasonography, which is basically an ultrasound-based method of measuring brain blood flow. And we did that before and after a 12-week cognitive training program to see whether there were any changes in vascular function in the brain. It was quite a small study because it was a feasibility study, but we found that the majority of participants completed the trial, so around 90% were able to do the cognitive training and complete all the brain blood flow measurements, which is good because there is potential to take this trial forward in a bigger multi-centre study. Although it was small, we did actually find some changes in brain function. So in healthy older adults, we found that blood flow responses decreased to one of the tasks that we gave them to do, which might suggest that actually the brain was getting more efficient and needing less blood flow to execute those tasks, which is what we tend to see in younger adults when we compare older and younger adults. In the dementia group, it was the opposite pattern. So when we looked at mild cognitive impairment patients and those with Alzheimer's disease together, we found that the number of blood flow responses overall to all of the tasks that we gave them increased, and that was significant. So even though it was only a small group, we were starting to see some changes. So what we'd like to do is take this further in a bigger study with more participants to look at these changes in a bit more detail and to see whether they also result in improvements in cognitive or sort of actual brain function as well. So I think what would be really exciting to take the study further is to add in the physical exercise or physical function as well as cognitive. So this study only used a cognitive training program, but I'd be really interested to see how the effects on brain vascular function are mediated by both a cognitive and a physical exercise program, either in combination or to look at the two to see whether one is better than